Dr. Mac,
Yes, ma'am. How are you today?
I'm good. How are you today?
Oh, long week. Doing good. Doing good.
Woo! You are telling the truth about that. It has been extremely, it's been a long month,
Yes.
an
Yes. Yes.
extremely long month. And we still have a couple of days left in September. And then we can roll on into October and let it do what it do. But before we do that, uh, first of all, our viewers, thank you so much for tuning in to share with us today. And of course, you know, Dr. Winston, I'll say that properly, Dr. Winston D. McIver Jr. of
Oh
Walk
man.
Primary Care,
Oh man.
as Jesseline Pack says, aka Dr. Mac. She
Thank
tunes in
you.
every single week. Thank you, and we
Thank you.
appreciate you posting on Facebook. She tries
Yeah.
to keep us on top of the news too.
She does. She
Yeah,
does.
you do an
She does.
incredible job. Absolutely. Thank you so much. So we have Dr. Mack here with our week 26 COVID-19 updates. And we're also going to talk about breast cancer today, impact of breast cancer, particularly on African American women. And so Dr. Mack is going to share some information about that particular subject during the medical minute. And so, you know, we just got a lot of good things to bring to you today. And hopefully this information will enlighten you about what's happening, at least in the past week. And then also what you can take with you into the coming weeks and days. So also, Jamila, thank you for tuning in with us. She says, hey, Dr. Mack, and we appreciate it. I just want to say thank you to Jamila and the Emmanuel 9 Memorial Foundation. They are one of our broadcast destinations, and we certainly do appreciate having all of our viewers from that particular site on Facebook. Please visit that site for important information about the work of the Emmanuel 9 Memorial Foundation, and leave them some great information, inspire them to do what they're continuing to do. Hopefully you can donate from that page. I don't know. Jamila, let me know. We certainly want to plug that. Any help that the community can give to the foundation to continue their efforts is always appreciated. And again, thank you for being one of our broadcast destinations for the network live. So Dr. Mack, I'm going to turn it over to you. And I know you typically give us some numbers in the beginning, and then we'll go to some charts and graphs. So let me know when you're ready.
Okay. I'll go ahead and start with the numbers.
Okay.
So again, glad to be here again, April, doing what we've been doing, which is disseminating information. Specifically, what we've been doing each week is talking about the numbers week to week. This past week, worldwide, the number of cases of COVID have gone up about 2 million. We're now up about to 32.6 million people who've been positive worldwide. The number of deaths worldwide have gone from 954,000 to 991,000 deaths. In the United States, in the last week, the number of cases have gone from 6.9 million to 7.2 million. And the number of deaths have gone from 198,000 last Friday to around 207,000 currently. Specifically in South Carolina, the number of cases over the last week have gone from 135,000 to around 142,000. And the number of deaths in South Carolina have gone from a little over 3,100 to a little over 3,200. Horry County, statewide, they started doing something a little bit different now, in that their actual deaths and then their probable deaths related in cases related to COVID. So in Horry County, there's about 1,900 and in Horry County, there's about 9,900 cases, but about 331 probable. So let me say that one more time. In Horry County, the cases are around 9,961, but probable 331. So in other words, they've had some cases that they're still waiting, that are pending, that are probable COVID. Likewise, with the deaths in Horry County, we're at 185 confirmed and 11 probable. Georgetown, there's about a little over 1,700 confirmed with 129 probable cases. The number of deaths in Georgetown, they've got 36 confirmed cases and they've got 183 probable. which kind of was alarming on that number. I had to go back and double check it with DHEC, but they got 183 probable. Marion County, 848 confirmed and 12 probable, and Marion County, 24 deaths. So as we see a couple things that's happening, number one, the biggest thing I think that's happened is you're seeing a lot of dissension with some of the people that were initially with President Trump and what he was saying and doing. A lot of dissension between Fauci and he, Dr. Deborah Birx and he, Dr. Redfield from the CDC, and the Surgeon General. So I think, again, at a certain point in time, some of the information that's being disseminated, as physicians, we have a duty to first do no harm. We have a duty to tell the truth the way the numbers are. And when things are being said that, specifically in this case, with it being a public health risk, as a physician, you have to first do no harm, and you have to, we took an oath to serve and protect. And so at a certain point in time, these people had to break with some of this nonsense that was being said. Now, for today's talk, I want to kind of break it down into the good news and the bad news. Okay. The good news, the hospital numbers appear to be decreasing related to COVID. That's a good thing. The daily deaths, although they're still high, they appear to be decreasing some. In other words, during the summer, we'd gone a large part of summer where we were averaging over 1,000 deaths a day. Well, now we're less than that. We're still hitting anywhere between 600 and 800 a day, but it still appears to be going down. And in most states, the numbers appear to be decreasing in cases and in deaths. However, here's the bad news. There's 7 states in the United States that appear to have an increased uptake in 7 and 14-day averages of COVID cases. South Carolina being number 1. These numbers.
Say that again, Doc. Please say that again.
Okay, so in most states, the numbers are either staying the same or decreasing in the number of cases. Right now, a lot of that's controversial because we're not testing nearly as much as we were doing during the summer. Okay. However, there appear to be 7 states that the numbers appear to be increasing. And these numbers are based off of populations per 100,000 people. So that way you can compare South Carolina to New York, South Carolina to Texas, South Carolina to Florida. We do it statistically per 100,000 people. And South Carolina is at the top on the 7 and 14-day average for number of cases. Now, that's very bad news because we're not testing nearly as much around here as we had been testing. That's worrisome and very concerning. The other states that have seen increase in numbers of cases over the past 14 days are Arkansas, Nebraska, Oklahoma, Wisconsin, North Dakota, and Missouri. So those states, it has been shown an increase there. Now, whether or not this is a fluke with the numbers, whether or not we're seeing as a result of Labor Day activity around here, all that still will be determined over time as the numbers sort themselves out. The other part of bad news is winter is coming, fall is coming. That certainly ushers in cold season, flu season, strep season, where people are just going to statistically get sicker. So that is of concern to physicians, public health officials. The other thing that's a part of bad news here is that we're getting into colder months where we'll do more indoor activities. Right? So during the summertime, it was more outdoor activities. People were out more. The weather was warmer, nicer. But as the weather gets cooler, people will tend to be indoors more. So there's a concern that may usher in an increase in the numbers of cases. The other thing that a lot of physicians are concerned about is what we refer to as COVID fatigue or COVID burnout. We've been talking about this now for upwards of 7 months. And, a lot of folks are just They're just getting tired of being cooped up, so to speak. They're tired of being restricted. They're tired of, wearing masks and tired of doing some of the things that we needed to do to see these numbers come down. Over in Europe, they're having a major problem right now. Over in Israel, Europe, a lot of countries overseas are having significant increases in COVID numbers over the past 3-4 weeks. So, with the numbers, like I said earlier, I don't know if it's trying to go out of the first phase. Typically, these pandemics will have more than one phase. Unfortunately, what's anticipated to be a second phase will likely happen during the winter time. And unfortunately, this is expected to be a tough winter by all accounts, by the statistical people that look at these numbers. Yeah.
So, Dr. Mack, as we look at all of this, and as you as medical professionals try to project what may happen over the cold and flu season, there's always the conversation about how cold and flu season impacts communities or impacts people in terms of illnesses and deaths as well. And I think, weeks ago, we talked about people being careful about trying to compare COVID to, some of these other types of diseases or illnesses, because as we know, and as we've learned over these weeks, COVID can exacerbate a lot of the problems that people have, the pre-existing conditions. So what kind of, advice or insight can you give everyone about, how COVID could possibly impact cold and flu season and what they need to do in order to determine whether or not their case is a COVID case or just a simple,
Right.
Another type of illness is coming on?
Well, it's going to be tough. I mean, it's going to be tough. And, physicians are going to have a tough job. I mean, you're going to have to determine whether it's a common cold, flu, strep, pneumonia, COVID. I mean, you're going to have to determine that. And again, it's going to have to be, a detailed history, information obtained, and doing the appropriate studies that need to be done to test to see if, in fact, that's what the case is. I strongly encourage folks that are over the age of 65 and those people that have chronic medical conditions, lung conditions, diabetes, asthma, previous history of cancer, to get a flu shot. Okay. Mm-hmm. We'll talk about the vaccines a little bit later related to COVID, but the flu vaccine is a little bit different. And let me say this, okay, because I've got to say this too. You cannot get the flu from the flu shot. Okay, let me say that again. Adult flu shots are killed vaccines. They're not a live vaccine. So what happens is the flu virus is grounded up in the particles and it's injected. Your body's immune system responds to those particles. It is not a live vaccine. Now, some people may get a little achy. Some people may actually get sick, but it's not the flu. It's your body's response to what it should be doing, which is mounting an immune response. So when you do see the flu, your infantry troops, so to speak, are there ready to fight. Mm-hmm. Again, you cannot get the flu from the adult flu shot. Again, you cannot get the flu from the adult flu shot. Will you get achy? You might. And really, in the truth of the matter, you want to get a little achy, because that means your immune system is mounting a response to be ready when and if you do see the flu.
Gotcha. Okay.
Okay. Mm-hmm. So that's important. The other thing that's important is if you got any kind of, like I said, if you're taking medications for any kind of chronic conditions, including diabetes, asthma, emphysema, COPD, you need to take your medicine. If you have not been on your inhalers and you're supposed to be taking it, you need to be taking it. Okay. You need to call your physician and get those refills. Mm-hmm. You need to continue to wear your mask. You need to continue to try to social and physical distance as much as possible. You want to try and stay, farther than 6 feet. for, no more than 15 minutes of close contact with folks. It's going to be very important because, the numbers are looking like it could possibly be 230 to 250,000 deaths before the end of this year. Unbelievable. If you would have asked me that 5 months ago, I would have said no way. But it's looking real. And the concern is that, like I said, the concern about the COVID fatigue, COVID burnout, people just still have to understand that this is a marathon. It's not a sprint. It's not a sprint. We will be talking about COVID-19 in 2021. Now, I don't think it'll be as destructive. I don't think it'll be as deadly. But I do think we'll still be talking about it. And so, folks, it's very important to really understand this and understand that as the weather gets colder, as cold and flu season approaches, this can get worse. It can get a lot worse. For a reminder, the second phase of the Spanish flu had more deaths than the first phase. Now, I'm not saying that's what's going to happen, but I'm just saying that did happen.
Well, yeah, and it's a lot to take in. And as we are trying to at least, I think a lot of people are just so anxious to be in recovery mode and to get back to, I won't say get back to our normal because we won't be normal as we know it, but to, create a, normalcy for them, for themselves. We just have to make sure that we are doing our part to mitigate the spread of COVID. And, I was having a conversation with some wonderful people today at lunch, and we were talking about the perspective of it all and how, you look at the numbers for COVID and then you look at the numbers for other diseases, and you kind of say to yourself, well, if I'm just going to throw something out there, if heart disease killed 700,000 people, what's 200,000 people who succumbed to COVID? But from a perspective standpoint, it goes back to something that we were talking about a little bit earlier, which is, how quickly did that happen? People with heart disease typically, and you're the doc, you can tell us, but it's not something that you just wake up one morning, you have heart disease, and then you could die 3 days later. It's probably something that's been building up over time or whatever. Whereas COVID, I don't know, it just seems to be still a bit unpredictable, Doc. Am I right about that?
You're right. You're right. And the other thing about the analogy that you made is that some heart diseases are just going to happen because of genetics, right? So they're what's called non-modifiable risk factors. You can't change that. You can change what color shirt you wear. I can change what color bow tie I wear, but we can't change our family. And so there's some things that are just going to be in families that are going to make us more susceptible. Even the person with the best diet, even the person with the best, attitude about these things can still get heart disease. However, COVID can be prevented. And there's a change. There's a big difference if you do what you're supposed to do. But there's some medical things that will happen that you cannot control. Now, you can control whether you die from them because you're doing your due diligence to get checked and things like that. But there's some conditions that you just can't do anything about because it's in your genetics, it's in your DNA. COVID is not in your DNA.
Right. Exactly. Right. Exactly. Okay. All right. Well, do you want us to go over to the charts and graphs? You need a second?
Or? Charts and graphs that I kind of show it a little bit more.
All right.
All right.
Let me pull that up. And okay.
Okay. So let's go to the other one first.
Okay. Which one you want to start with?
Yeah. So let's start with that one. So
you want to start with that one? Okay. All right. Okay.
Let's start with the other one.
Okay. No problem. No problem.
Okay. Good. Right. So this is just kind of an overall snapshot of the number of deaths here. Okay. Deaths and cases. So as we see, the numbers are coming down. Like I said earlier, they are coming down. But again, it hasn't flattened. And so that's the concern right now, is that, were we trying to get out of the first phase, or is it an extension of the first phase? Again, we do see where that 1,000 is, and the graph is below the 1,000, which is a good thing, because that's an ominous sign. You're talking about 1,000 deaths a day, but we're still haven't flattened. And so for that to happen, we've got to do our part. As we see, the number of cases has gone up, in the last 14-day change. The number of cases, that's what that 10 is below, that plus 10, it's gone up 10%. So the number, this is South Carolina now. This is cases in South Carolina, has gone up 10% in the last 14 days. That's worrisome. That's concerning, because we know we're not testing nearly as much as we were testing 2-3 months ago.
Right. But
to still have a 10% increase in the number of cases. Now, as I said before, the negative 28 below, underneath, means that the number of deaths have gone down 28% related to COVID, but the deaths are still high overall. They're still higher than they should be overall. But the biggest thing is those number of cases, and that increase in 10%. That's amongst the leaders in the United States statewide. Okay, the next slide. Looks at the similar reported number of deaths, and as we see, likewise, like I said earlier, we are on a decline death-wise. But again, the cases are going up. Now, is this number of deaths going to start to go up because we're having more cases now? Only time will tell that. But you have to imagine, out of that 10% increase, some of those people were going to pass away, unfortunately. But we did, a positive sign, like I said, was that the number of reported deaths were going down, as well as hospitalizations. Okay. Right. So I just wanted to show that just as a graph to kind of, show what I'm talking about.
Absolutely. Well, again, we thank everybody for tuning in today. All of our viewers, who, especially the ones who are with us weekly, been with us from the start. We really do appreciate it. And Dr. Mack just gave us our COVID-19 weekly update. Just talking about what's real and what we have to continue to consider as we navigate through COVID land, pretty much. The next part of our show today, we're going to talk about breast cancer and just give you some information, just increasing your breast cancer awareness. And, we hope that this information will be enlightening, and will also encourage you to, especially as females, African-American females especially, but females in general, to, have go check the tatas, make sure you go and get your annual mammogram, just to make sure that everything is okay. But before we get into that, Dr. Mack, I definitely wanted to go back to Jamila posted a comment about what they're doing with the Emanuel 9 Memorial Foundation. And she says, yes, we just started our $17 on the 17th campaign, but you can donate anytime on the foundation website. And that foundation website is emmanuel9.org. So make sure you do that. Make sure you support the foundation. Go to emmanuel9.org. And when she says $17 on the 17th, basically on the 17th of each month, this campaign, that's like a little campaign blitz that they do or whatever. And I noticed it last month and was trying to help push it. And now that I know it happens, we're going to definitely do our part to help you all. So thank you for sharing that information with us, Jamila. Also, Amanda Butler's tuning in today. We appreciate you being with us every single week as well. And she says she feels like you're talking directly to her, Doc. Let her go get her inhaler. But yeah, when it comes down to COVID, especially for someone like Amanda, you just can't play with it because of, all of the things that go along with it, including, especially the respiratory issues. I also want to make mention that I'm wearing this great T-shirt, register, show up, vote, register, show up, vote. It was given to me by Miss Mary Pryor. And yes, Doc has one, but he has to show off the bow tie. He's so conflicted. Maybe he should have done the T-shirt with the bow tie. Who knows? But Miss Mary actually she gave us these shirts, and they are doing some great things over in the Myrtle Beach area to make sure people will register to vote. And now it's time to mobilize and get those strategies together to get people out to vote. So yeah, it's not enough to just register. You have to show up and you have to vote. So do what you can in your community to help others who are having any kind of issues with registering. I think online registration is still, you can still do that. But, you know, in terms of getting to, oh, okay, did you see that comment just popped up? I'm not going to call her name, but you, we got you. We got you. Okay. We you know, we want to make sure that everyone knows that it is critical that you exercise your right to vote in this all important election, and that you pay attention not only to the national elections or the general elections, but also any local races that will impact your communities directly. Actually, those races are some of the most important races, if not the most important races, that you will you know, have to make your decisions on. So you know, over the next couple of weeks, we'll be sharing more information as well here on the network live. And then I'll also be sharing it on my second gig, which my first gig, second gig, however you want to call it, which is Whittemore Community Magazine on Mondays at 7 p.m. So I just wanted to put that out there. And, you know, thank you again, Mary Pryor. We appreciate it. And if there's any information you want us to share, we'll be more than happy to do it. And of course, Dr. Mack will tell you, you can choose to absentee vote. If you choose to stand in line on November 3rd, that's wonderful. Just, you know, and we want you to do that. We don't want you to be afraid to go out and vote, but make sure you mask up and practice the social distancing as much as you can whenever you go to vote. Okay.
Right.
All right. So just wanted to share that with our viewers as well.
Right.
So Dr. Mack, do you want me to go to the slides, or you want to kind of kick it off?
Let me say a couple things first. Again, I want to thank Ms. Pryor like you did. Thank you for the shirt. I appreciate it. That's very thoughtful of you. The second thing I want to say is I'm proud and happy about the Emmanuel 9 Foundation. Just a little bit about Jamila. Jamila is my first cousin. Jamila's mother and my mother are sisters, and one of their sisters was actually one of the Emmanuel 9. So Jamila is a lifelong member of Emmanuel. When I lived in Charleston, I attended Emmanuel. That's my family's home church. So it has very dear meanings and very dear sentimental memories for me. So I don't really want to go into that. But our aunt was one of the Emmanuel 9. Okay, so Jamila is working with the church through the foundation to raise money, and they're doing a wonderful job. And I just want to give her a shout out and thank her for linking up with us and having these being a destination for us. Okay?
Yes, it helps us to get this information down into the Charleston area, and we certainly do appreciate that. Thank you so much, Dr. Mack, for saying that. Absolutely. Yeah.
Yeah, so we can go to the slides.
All right. Okay.
So in talking about this, April and I talked about, you know, developing the show further to talk about medical information and medical minutes. And so basically the thought was in addition to giving COVID information, we'll talk about some topic related to health and wellness. October is Breast Cancer Awareness Month. And as this slide says, breast cancer is the most common cancer among African-American women. In 2017, approximately 30,000 new cases were expected to occur. Now we're talking about 40,000 deaths per year with breast cancer, as well as around 265,000 diagnoses a year. Now, there are over 3 million women that are living with breast cancer in the United States. Some are cancer-free. Some have breast cancer and still undergoing some form of treatment. But I just want to make that clear for statistical numbers, over 3 million women. Okay, next slide. Okay, so when we look at the breakdown of breast cancer diagnosis by age, the majority of the cases are between 45 and 75, just to kind of give you a breakdown on the cancer diagnosis so we can see that. There are some that happen earlier in the 35 to 40 range, 44 range, about 10%. But by and large, most of them are around 45 to 75. And this is important because this is around the time that women really need to start getting their mammograms. Okay. Now, I do want to say this before we go to the next slide. Breast cancer is not just a cancer in women. Okay. In 2020, it's estimated that about 2,600 men will get diagnosed with breast cancer, and over 500 men will die from breast cancer. So it's not nearly as common in men as it is in women, but men do get breast cancer. And in my practice, I've been seeing patients now for almost 30 years. I've had about 5 cases of men that have had breast cancer. So it does happen in men. So men, if you notice anything irregular in your breast as well, you need to get to a physician to get it checked out.
Okay? Dr. Mack, is the test the same for men as it is for women?
Yes. Okay. Mammogram followed by, an ultrasound if something's abnormal, followed by a biopsy if that step needs to be taken.
Okay.
Yes. Mm-hmm. Now, breast cancer, the next slide. Okay. Now, in the African American community, women are about 40% more likely to die from breast cancer than white women. And part of that reason is because of detection. So if it's detected later, and I'll get into 5-year survival rates a little bit later, but if it's detected later, you're going to be more likely to have more complications and or a death from breast cancer. Okay. The incidence of breast cancer in men and in women of all races are about the same, but the deaths are significantly different. We'll talk about that in a second. Okay. Take the next slide. So breast cancer facts. Death rate 41% higher in African American women statistically. Minority groups have about 1 in 8 chance of death from breast cancer. Again, 1 in 3 are between 40 to 64, as I said earlier. 31%, there's some question or issue of affording mammograms or affording physicians visits for early detection. And about 37% of African American women show up with breast cancer in later stages. Mm-hmm. And I'll tell you, we'll go over that in just a little bit about why the stage, meaning how far it's spread, or the grade, how aggressive it is important in 5-year survival rates. Okay. Breast cancer is the most common cancer in women, except skin cancer. So skin cancer is high, but breast cancer is way up there. And it's estimated in 2020 that 30% of all new cancers in women will be breast. Let me say that one more time. In 2020, it's estimated that of all cancers in women diagnosed, 30% of them will be breast cancer. Okay. Now, since 1975, the 5-year breast cancer survival rate has improved. It has improved. However, in all races. However, there's still a statistical gap between African American women and white women. There's still a gap that's there. Okay. And especially in later stages of breast cancer. And that has a lot to do with just early detection versus late detection. So it is very important to get these mammograms early, and it's very important to get checked. So the way that we have it, you should do monthly breast exams on yourself, women. Monthly breast exams. You start from the center, where the areola, the dark part of the breast is, and you work your way circular outwards. If you feel any knots, lumps, bumps, any abnormalities, it needs to get checked out. Statistically, it's probably just dense breast tissue. However, you need to make sure that you're checking yourself monthly. And you need to make sure that if you have any abnormalities, that you get checked out by a physician. Okay.
Now, Doc, I have to ask. I have to ask, because you talked about the density of the breast. When you are, when you have larger breasts like me, Will the standard breast exam work, or is there another way that we have to position ourselves to make sure we are feeling the breast tissue in the same way as someone who might be a little leaner than us?
Well, typically the way you're going to do it is you're going to have your hand over your head, and you're just going to kind of press firmly, making sure that you keep contact with your fingertips and the breast tissue all the way around.
Okay.
So it does make it a little bit more difficult the denser or the bigger the breast. However, you still, the technique is still pretty much the same.
Mm-hmm.
Okay. But you need to definitely, if you got more density to your breast, if you got larger breasts, you definitely want to include the physician checking the breast as well.
Mm-hmm.
Okay. So that's very, very important. Very important.
Mm-hmm.
Okay. Now,
I was going to ask if there were any other signs aside from feeling a lump or a mass or anything like that.
Right. So some of the signs and symptoms that go along with breast cancer, some is what we call dimpling in the breast. So if you see the breast that appears to be pulling down or a dimple in the breast, that can indicate some density, not necessarily cancer, but something going on in the breast.
Mm-hmm.
Also, a retracted nipple. If the nipple is inverted or retracted, you need to make sure that you're getting it checked, because it could be something on the inside pulling the nipple in.
Okay.
Sometimes it's normal, and that's just normal development of the woman. But sometimes it could be a retraction on the inside of the breast that's pulling on the nipple.
Mm-hmm.
Of course, having a bloody discharge from the nipple. Okay, that can also be that's a worrisome sign about possibly having breast cancer. So those things need to be looked at very, very early on with having any of those. Okay. Mm-hmm. I think the next slide is going to talk about risk factors.
Yes.
Okay. So in the risk factors with breast cancer, of course, being a female is a major risk factor. As I said early, and that's just because there's more breast tissue that's there. And a lot of this breast cancer is hormone estrogen related. So that's one of the reasons why it's much more common in women than men. Increases in age is a risk factor. As we said earlier, there is a gap there between 45 and 75 where you really need to make sure that you're getting checked and evaluated. Family history of breast cancer. That definitely is important. In women that have one first-degree relative of breast cancer, they're 2 times more likely to develop breast cancer.
And what does first degree mean? First
degree means sister, mother, close relative.
Okay.
Okay. Now, if you've got more than one first-degree relative with breast cancer, you're 3 to 4 times more likely to develop breast cancer. Okay. So let me say that again. One first-degree relative, you're 2 times more likely to develop breast cancer. More than one first-degree relative, you're 3 to 4 times more likely to develop. Also, personal history of breast cancer. Those people that have had breast cancer once are at an increased risk of having breast cancer again. Now, those are what we call non-modifiable risk factors. You can't change your family, and you can't change the fact that you've had breast cancer before. So those risk factors you can't change, so you got to be on top of that majorly. Okay. Other risk factors include diagnosis of atypical hyperplasia. Basically, what that is you've done the mammogram, you've done the ultrasound, they see something there, they do a biopsy, the cells come back not cancerous, but they come back not necessarily normal tissue. So it's kind of like in the middle. Those people, it's a higher chance that those cells could turn into breast cancer cells. And also what's called BRCA1, BRCA2, that's a genetic thing that kind of runs in families with the certain types of cancers that are family related. Okay. Now, some of these minor risk factors, and a lot of people don't know this, but I put this in here because this is very important. If women that have had started menstrual cycles or menarche before age of 12, that is a risk factor. And it has to do with estrogen, and it's hormonal related. The earlier you start your cycles, the longer you're going to have cycles and the more estrogen your body will see.
Mm.
Or later menopause, having it after 55. Again, the estrogen being around longer. So that's very important to make sure that you understand that. Early cycles coming on, and later the cycles go off. That is somewhat of a risk factor. Also, nulliparity. That means that you've never been pregnant before. That increases your chances of having breast cancer. Again, when you get pregnant, the estrogen goes down, so you're not exposed to as much estrogen.
Okay.
I used to deliver babies, April, so I used to do all this stuff.
You must have been in my head because I was going to ask you, what does that have to do with the breast cancer?
Right.
Yeah, estrogen is the deal.
I used to deliver babies. I used to do a lot of in before I came back home. So that is first childbirth after 30. Again, an estrogen related thing. Okay. So the later you have, either not having babies or the later you have babies, are somewhat of an increased risk for breast cancer. Estrogen replacement, hormone replacement, because it is estrogen, and if you have that gene that is estrogen positive, that can increase your chances. Okay. Also, decreased activity level, obesity, weight gain, increased dietary intake and fats, increased alcohol, increased tobacco use. All those are also risk factors. And those are what we call modifiable risk factors, because you can change how much activity you do. You can work on the weight, you can work on the diet, you can work on the alcohol, you can work on the smoking. Those are modifiable risk factors. Okay, so those are very important. Now, something else a lot of people didn't know was breastfeeding is actually a protective thing against breast cancer. Again, exercise, as I said, 3 times a week, usually considered, and having a child earlier on is also appears to be a protective factor.
What's the connection between breastfeeding and
again, it's a hormone thing. It's a hormone
thing.
And so with that, that's basically what it's a hormonal thing.
Okay.
A lot of the breast cancers now we're finding are hormone and estrogen related. And so again, a lot of it is related, and hence again why men don't get breast cancer as often, because men don't have the higher levels of estrogen that a woman would have. And so that's the connection there.
Okay. I know you mentioned, of course, exercise, diet as a factor. Is there any link to foods that we eat and, I guess specific foods that we eat that contribute to a higher risk of getting breast cancer?
Well, yeah, I mean, with those factors, they're more retrospective. In other words, in medicine and science, there are different types of studies. And a retrospective study means you look back you look at the people who have breast cancer and you look back on what things they have in common. So it's not like you're following them along. You're looking at it after the breast cancer has been there, and then you look back on what things these people may have in common.
Gotcha. Okay.
And so that's what we call a retrospective study. We're looking back on it. So it appears diets that are high in fats, higher in processed foods, not only just breast cancer, but cancers in general. Colon. And again, that's from retrospective information, looking back on the fact. Well, how much did you eat fried foods? How much did you eat fatty foods? How little did you exercise? Those kind of questions are asked to then come up with this retrospective information.
Okay.
Yeah. So I don't think was that another slide?
Well, I'll have just a couple of slides that I was going to share, just to kind of.
Let me
go ahead.
I always, whenever we're talking about cancers, and you all hear me say this, we talk about in terms of 5-year survivals. I think we talked about that with prostate last week. We talked about.
Yes.
Yeah. So the 5-year survival rate in African American women for breast cancer is about 81%. 5 years of that's overall. Now I'm going to break it down in just a second, but overall, 81% in African American women, 91% in white women. That's the overall 5-year survival rate of breast cancer.
Well,
However,
Dr. Mack, before you go further with that, why is there such a disparity between white women and Black women? Is it the access to health care, or
it's a lot of things? Access to health, early detection.
Okay.
It's a lot of different dietary, family history.
Okay.
So it's a lot of different things that are involved there.
Okay.
Yeah, that's the overall 5-year survival. Mm-hmm. However, when you break it down, it depends on the stage, which means where that tumor is. Is it still localized to the breast, or has it moved to some other organ? And it also depended on the size of the tumor. Okay, so if the tumor is found in a localized area, meaning it's right in one place in the breast and it hasn't moved anywhere else, it's localized, you're talking about a 99% 5-year survival if it's found locally. If it's regional, which means it's moved into the lymph nodes, it's moved away from that site, not too far, but away from that initial site, you're talking about 85% survival rate at 5 years. If this thing is moved distantly and it's gone throughout your body different ways, your 5-year survival rate is about 27%. That's the reason why it's so important for early detection, self-breast exams at home monthly, getting your mammograms done every year, making sure a physician is doing breast exams on you every year. Okay, that's why it's important, because if it's taken off distantly, only 27% of people are alive in 5 years, as opposed to 99% if it's local.
Right. The physician exam, there's some women who, after a certain age, typically, they won't go to a gynecologist as often or whatever the case is. So is this something that you should request and still continue your gynecological appointments, or is this something that a GP or a general practitioner can perform as far as
it can be done by either physician.
Okay.
However, they get into some issues with the insurances as to at what age will they stop paying for mammograms. So there's a lot of controversy in medicine about that. A number of the insurances won't cover it after the age of 70.
Right.
So again, you need to check with your individual insurance to find out at what age they stop covering mammograms, and that kind of thing. But you can still go to the physician and still get your breast checked. And if they find something, then that can sometimes get a prior authorization from the insurance to override whatever they have based off of a symptom. Okay.
All right.
Good. So, again, cancer screening in general is what I went into primary care for. When I first went to medical school, my thought was not to be a primary care physician. But again, I saw where I could make the biggest impact. And this was one of the ways that I could make a big impact in my community. And so this is very important. It's very dear to me that people get checked, and they're vigilant about it, about getting checked. Okay.
That's right. And speaking of getting checked, Doc, when was that? I think that was Wednesday. It was Wednesday. I had my mammogram appointment, my annual appointment, and went in for the exam, and actually was pleasantly surprised that I could have the 3D mammogram, because that's something that has kind of come into play or into existence within the past year or two. And so I just wanted to kind of I wish I thought of it when I first arrived, and it's to seek permission to actually record it. I wouldn't have mind showing you guys. I would have covered the tatas, but I think it's important for females to understand that there's so much when you get into conversations with people about their mammogram experience, sometimes that creates fears and anxieties about what that test is really all about. And I'm sure that back in the day, before medical advancements, it might have been a little bit more uncomfortable than it is now. but you can't let the fear of the test keep you from being tested. And so, I went in and I actually had my mammogram, and I'm just going to show you a photo here. It's actually one that I used on the promo, but as you can see, this is the actual 3D machine that is with a particular hospital system. And, it actually was not uncomfortable, at least not for me. And I don't know if it's because of my density or not, but, it may be a different experience for each female. But it was actually better than I thought it would be. But I was excited because of the 3D quality of it and being able to see more of my breasts, and I guess deeper into my breasts is what the 3D does. Is that
Exactly.
what the 3D is? Okay.
It
and
has
so
a third dimension. It has a third dimension.
There you go. And so, this is what the actual machine looks like. And it really didn't take that long. And they were very thorough about the photos that they wanted to take, or the images that they wanted to take. So basically, there was the frontal image, placing your breast tissue on the actual plate, so to say, and then, coming down with the top plate and just kind of tightening it a bit so that they could stabilize it and get a good image, asking you to, not breathe for a certain amount of seconds so that the image could be, I guess, clear. Right. And then, they just took it at a series of angles, including, one thing that I think we, as women, we don't realize is that it isn't just like the frontal part of your breast. It's all up, it's up here as well, and into this region. Go ahead, Doc.
And I'm glad you said that, because when you check your breast, you need to make sure you get into the armpit. Mm-hmm. That's called the tail of the breast. And a number of cancers are actually found in the tail of the breast. The breast tissue goes almost like, I don't know, kind of like oblong, kind of like a teardrop to the side, where there is some tissue up in the armpit. Mm-hmm. That's called the tail of the breast. And that's very important to make sure that you follow that and check in there when you're doing your self-exams. And make sure that the physician gets in the tail of the breast too. Mm-hmm. So it's not just the tissue itself, it's also in the armpit.
In the armpit, exactly. So There was a moment when I had to, kind of turn with the machine. Actually, she asked me to bring my arm up and over the machine so that they, like you said, could get into this area and all the way around, and just kind of lean into the machine. And for me, I'm thinking, that's significant as well, because I've just recently, I'm trying to, get away from things that are particularly harmful to us in terms of chemicals and, things like that. And one thing that I've taken up as an effort, I've switched my deodorants from the aluminum-based deodorants to aluminum-free, because I just noticed that with a particular type of deodorant I was using, had been using it for years, and all of a sudden there's some irritation going on, and it's itchy, and there's a few other things that are happening. And so I've switched up the deodorant. Now I'm using an aluminum-free product, and I love it, and the irritation is gone and all that. And I'm sure that, I've read that, you have to be careful about those types of things, as well as those chemicals probably could have some bearing on whether or not you I guess would be susceptible to any cancers or whatever from that. So is there truth to that?
Well, there is some question about it. It has not been shown to be statistically based on that. However, any kind of chemical like that, I would stay away from. Mm-hmm. So even though the science hasn't necessarily said definitely yes, it hasn't said definitely no.
Right. And so, and what motivated me to just switch up was just, noticing that there was something different, like it's when we have our favorite toothpaste or even deodorant or hair care product, we notice that, okay, it doesn't work like it used to or whatever, or there's something different about the formula. But even saying all of that, I just wanted to, make sure that the ladies understand. And I guess it was so appropriate that I happened to be wearing that T-shirt that day. The self-love is all about making sure that we definitely take care of, every part of our bodies, including the tatas. And so it's amazing how God works. I think when I spoke with Dr. Mack, it was after this, as a matter of fact, he says, oh, by the way, we're doing breast cancer this week. And I said, guess what? Yeah, I just had my mammogram. So yes, this is so appropriate for the week. So I think that this is information that is invaluable. I mean, nobody can put a price on getting this information. And as Wendy Willis, hey, Wendy, thank you for tuning in today from New York. As she said, she's way beyond needing one. Thank you for reminding her. And yeah, we have to be vigilant and, have our annual exams, especially when we're of a certain age, to make sure that we stay on top of things. Because as you know, we've lost, friends of ours in our community to breast cancer. And they're, friends of ours who, fought really long, hard fights. Pam Kelly, Vanessa Purtell, number of people. And, if we can save one with even this little bit of information that we're giving, then yeah, that's the idea behind all of this. So, thank you, Dr. Mack, for sharing that information with us.
Do me a favor. Can you go back to that graph that had the ages on it?
Yeah.
I think Brother McQueen had a question, and I was gonna.
All right, Brother McQueen, thank you for tuning in today. Let me go back. Let's see. Okay, it's the one that had the ages.
Right.
This
okay.
one? Okay.
Right. So what happens is that Brother McQueen, the reason why the insurances give for that, insurances are actuarial type people. They're trying to find how they can save as much money as possible. So after the age of 74, you start to see a downward trend in the diagnosis of breast cancer. Now, I'm not saying I agree with this, and certainly as a physician, I don't, but that's one of the reasons why insurances don't cover it, because statistically, the number starts to go down. You're out of the window of the three largest phases, which encompasses what, 60, 62, 63% of cancers. Or, and even further than that, you're 70 something if you include the 35. So if you include 35 to 74, that's what, about 70 some percent, right? And so the numbers start to go down. So that's the insurance's rationale behind it, is that it's less likely to happen in a person that's older. I don't necessarily agree with that, but again, you have to check with your insurances on that.
Yeah, that's very important. And I don't know what the cost is, to cover mammograms if you aren't insured, but
it's about $1,500, $2,000.
Woo! Really?
Yeah.
Wow.
Yeah.
Incredible.
And then, if you have to get ultrasound because they see something, then that's going to add to it. Yeah, and that'll add to it.
Okay. All right. Well, Dr. Mack, I'm looking through the network to see if there are any community announcements, and if is there something else you want to say to, I guess, kind of wrap up our conversation on COVID or either breast cancer, and then I'll make a couple of community announcement mentions.
Well, the biggest thing is just to make sure that as far as COVID, that we try to watch out for COVID fatigue. Still do the things that we need to do. That hasn't changed. I mean, the numbers we still are over 500-600 deaths a day. And so again, even though it's less than what it was, let's say a month or two ago, we still have people that are passing away. If we average just 800 deaths a day between now to the end of the year, that's another 45,000 deaths. So again, it's important to realize that. It's important to realize that we can do our part to help reduce this. The virus is going to be around as long as we don't do what we need to do. As far as breast cancer goes, October is Breast Cancer Awareness Month. I wanted to talk about it before we got into October, week before, so that way we can, bring some facts, figures, statistics, and some information that, you may not have known about breastfeeding and in early cycles and later cycles going off later, earlier cycles, that does seem to play a role in breast cancer. So again, another reason to advocate for breastfeeding is that does appear to reduce the chances of breast cancer, in addition to giving the baby the nutrients that the baby needs.
Right.
And it's very important. I mean, just to understand that, There are a lot of deaths that happen as a result of breast cancer, and a lot of it's just because people aren't getting checked early and often. The other thing too is that if you've got a family history of not only breast cancer but any cancer, that needs to be discussed amongst the family. Right?
Absolutely.
There shouldn't be any family secrets about cancer. People shouldn't find out at 50 years old that grandmama died from breast cancer.
That's right.
There shouldn't be any family secrets like that. And I encourage everyone on here to do an evaluation of your family and to talk to people and ask them real honest questions as to what kind of cancers run in our family. Not just cancers, but what kind of problems run in our family. But especially cancer, because that's going to be important, because a lot of these cancers are genetically based. A lot of these cancers will increase your chance of getting it. Like I said, if you've got a first-degree relative with breast cancer, you've got 2 times the risk of getting it compared to somebody who doesn't. If you've got 2 first-degree relatives, you got 3 to 4 times the risk compared to somebody who has no family history of breast cancer. These numbers are real. They're real. And so, like I said, even though the incidence of breast cancer does appear to be decreasing in all races, there is still a gap between people of color and Caucasians. And the reason a lot of times is just simply not getting checked. And so again, it's important, check, self-check, physician check, mammogram, ultrasound if needed, biopsy if indicated, treatment from there if indicated.
Brother McQueen has one other question, and I'm sure you may have touched upon this. What is a recommended diet for prevention?
Well, you want to try and eat as much fresh fruits and vegetables as possible. You want to try and stay away from, as much processed stuff as possible. Of course, including with dietary, you want to talk about exercise as well, making sure you're getting in at least 2 to 3 days a week. It's in some shape, form, or fashion. But a lot of times, we're a product of our environment. We eat what we grew up eating, or we eat what is reasonably cost, what's reasonably priced. And so again, it's time for a mindset to try to eat healthy, to live longer, and that kind of thing. Certainly tobacco and alcohol, as I said earlier, plays a role in this as well. But fresh fruits and vegetables, to answer your question specifically, Brother McQueen, try to reduce as much red meat as possible. I'm not saying don't eat any, but I'm saying just don't have that 6 days a week. Try and get in your omega-3 fatty acids. You want to look at your salmon, your fish like that, tuna, that have omega-3 fatty acids in it that can help not only your body in general, but can also help your cholesterol and your heart health as well.
All right, very good question, and definitely something for us to think about as we pick up our forks the next time we eat. It's when you try to make adjustments, some people they shy away from it because they feel like they're deprived. But making small modifications, I'm sure, will help in the long run and help you to build up to totally removing certain things from your diets or whatever. I'm not a big red meat eater, but because of cholesterol issues, I try to stay away from it as much as possible. But trust me, I love a steak.
There's nothing wrong with that.
Yeah, but you can't eat every day, just like you said.
5 days a week,
Right. Exactly. So,
and does Obamacare cover it? I'm almost sure they do. I'm almost sure they do.
Covers the mammogram.
Mammogram, right? That was another question Brother McQueen had.
Oh, okay. All right. Well, good. Well, that's good to know for anyone who's covered.
Sure. But again, you want to check with the insurance, check with the place where you're going to get the mammogram to make sure. But I'm almost sure it does.
Okay.
Because it's been big on wellness and prevention, so I'm sure it does.
Okay. All right. There's
Even after 75, I'm
yeah.
not sure about that. Again, most insurances at a certain age, and it's typically 70, 75, will not cover it. Again, because their rationale is, and again, I'm not saying that I agree with this, but their rationale is you have to do a lot more people to find that one that's positive over 75, as opposed to somebody that's 45, 50. You don't have to do as many to find that one.
And that's to justify the coverage.
That's to justify the coverage and the justify. Right, exactly. Okay. All this stuff is actuarial. All this stuff has to do with statistically how likely is this thing to happen at a certain age or after a certain age.
Right.
Right. And so that's what they base these things on. That's why, when you're talking about Chadwick Boseman having prostate cancer at 43, if he wasn't having any symptoms, his insurance was not likely to cover it, because statistically, you're not likely to see prostate cancer that young. Now, can it happen? Certainly. And I've been seeing patients for a long time, and I certainly have, but statistically, most people are over 50.
Have you seen a lot of cases in females younger than 50? It seems like I've, read about, for breast cancer.
Yeah, they almost always have a family history. And if not a first degree, a second degree.
A second degree, okay.
They almost always have had a family history.
Okay. All right. Okay. Well, again, great information as usual. Thank you so much, Doc. We really do appreciate you. And just wanted to make a couple of community announcements. The Bethel Social Action Committee, they are hosting a program on this coming Saturday. It's at Mask and Gloves to the Polls, free mask and gloves distribution location. Bethel AME is located at the corner of Race Path and Smith Street. So this coming Saturday from 12 noon until you can come in, and they're doing this along with their partners, Delta Sigma Theta and Alpha Kappa Alpha Sororities Incorporated. So their message is vote. Your life depends on it. It's time to vote. We can't stress that enough, that, you need to be registered, you need to vote. And they are providing some supplies for you to be prepared whenever you go. So you don't have to leave your car. They'll come to you and actually give you your mask, the free mask and the glove distribution packet, so that you'll be ready when you go to the polls. So that's one thing that I want you to know about. Also, the Association for the Betterment of Bucksport, they are having a drive-through food distribution on Saturday, October the 3rd. And I know we'll have another show before then, but I just wanted to, go ahead and put it out there so people can plan. So that'll be Saturday, October the 3rd from 10 to 2. The event will be every Saturday until November the 7th. So that's wonderful. This event is open to anyone in Bucksport and surrounding communities, to include Georgetown. But it's a drive-through style food distribution. They're feeding the community. This is happening at the James R. Frazier Community Center, which is at 1370 Bucksport Road in Conway. Food boxes will be on a first come, first served basis. There's no cost for this event. And the event sponsors are the Association for the Betterment of Bucksport and Spokes of Hope, supported by Councilman Orton Bellamy and Senator Ronnie Sabb. And again, this event will be every Saturday until November the 7th. I feel like I'm doing church announcements, brother. look, Deke, I feel like I'm doing church announcements. It's been a long time since we've been in there, but
there you go.
Yeah. And then you're going to particularly love what I'm about to say. We actually have, and when I say we, I mean Educate Our Youth, which is the arm of the Mamie Keith and Aline Bradley Educational Foundation Incorporated, which is co-founded by Janice Keith Thompson. She has actually invited special guests for her weekly show, which is Educate Our Youth. And basically she uses that platform to talk about educational topics that, support not only just career readiness, but college readiness, but also career readiness. So, we've had military talks. There's a virtual college tour series, and, financial literacy, SAT, ACT workshop information, you name it. Janet has had special guests on her weekly show, which comes on Tuesdays at 6 p.m. And I assist her. I'm on the board of that organization, but also I kind of backstage her show for her. But nonetheless, she is going to have Mr. Michael Gum of Morehouse College on this coming Tuesday. And he's going to talk about the Morehouse and, why it is the place to be. And he's also going to share, admissions information and, what they have going on now as, we deal with education in COVID land. So it should be a great show. Last week we had, we were supposed to have Allen University, but the representative was unable to make it due to a medical illness. We featured some information about Allen, but he has committed to coming back to do the show at a later date. And so, she's made it a point to cover as many colleges as possible. It isn't just HBCU. So for anyone who's watching, don't get it twisted. We are featuring college choices. And within that, there's 2-year, 4-year HBCUs, you name it. As Janet can book them, we will have them on the show. So make sure you tune in next Tuesday at 6 p.m. Yeah. Educate Our Youth right here on Facebook at Janet Thompson, Mrs. Janet Keith Thompson. Will be your host with Michael Gum from Morehouse College. And so
I definitely have to tune in and check that out. I'm Morehouse is, I can't even say,
you try to put it in even when we're not talking about Morehouse, you try to talk about Morehouse.
Yeah.
You plug it. Yeah. But it's a wonderful thing. Mm-hmm.
Yeah, good. I do want to say 2 things before I get off.
Okay.
I'd be remiss if I didn't say this. This weekend is my mother's birthday, so I want to wish her a happy birthday.
Yes. Happy birthday, Miss Marjorie.
It's also my wedding anniversary. So,
wow.
So I got married on my mama's birthday. And so again, you can imagine what kind of comments she made. It's 365 days in a year. You can't let me have my one day. So it is actually my anniversary and my mother's birthday on Sunday. So I just want to say that, and I want to tell my wife I'm just happy that you ran after me all these years ago, and I know you're still thanking yourself for doing that. And I thank you.
Oh no, you did.
Thank you, Angela. Thank you.
You knew you were gonna get it.
She did give me a great gift, my mother-in-law. And so I love my mother-in-law. I love my mama. I love my mother-in-law. So thank you, Angela, for running after me and giving me a great mother-in-law. I appreciate that.
It's all about you. I tell you,
happy anniversary, Angela. I know I'm gonna hear about this when I get home. I know
that is awesome. Yeah, everybody give them a round of applause. Just tight clap or applause in the comment section. That's wonderful. I wish I had bells and whistles on this thing. I'd do it. But yes, happy birthday, Ms. as we call her, Ms. McIver. And happy anniversary to you, Dr. Mac and Angela. Yeah, we appreciate and love all of you. So
thank you.
Yeah, celebrate. She says thank you.
Thank you. So we have to come up with our medical topic next week. I mean, if anybody's got any requests that they want to be talked about, you can please let us know. We'll try and get to it. I typically have things in my mind already in what order I want to do it. But if there are other, things that you want to talk about, want me to talk about, we certainly can. This is what I do. This is what I've been trained to do as a primary care physician. This is what I do.
Mm-hmm. Mm-hmm. And you do it well. You do it well. Yes. Trusted source. Been hanging out for 6 months now with the COVID-19 updates and all that. And I tell you, it's been a pleasure and a blessing, and we'll continue to do it. Just want to let everybody know also, I will have a very big, very special announcement next Friday, first Friday, October the 2nd, that involves the network. And so please tune in, please spread the word. April's got a big big announcement. Yes, it's something that I think you all are going to, at least I hope you will appreciate it, and much needed. And so I'm going to make an announcement about that. If you want to share this information today, of course, you can do it from the Facebook pages, and it's been shared across a couple of different pages, and of course on my personal page. But the easiest way to share it, especially for those who do not have a Facebook account, is to go to our YouTube page. So the YouTube page is actually the Network Connects Live. And if you go to that page, please make sure you subscribe. So you can go to YouTube, type in the Network Connects Live, and the page will pull up. And as a matter of fact, I'm going to show you what the page looks like so you'll know that you're in the right spot. But this is what the page looks like. And so you will be able to see all of the videos from our previous broadcasts. And since we've been doing this, basically, I mean, this YouTube page was birthed out of this particular initiative. So thank you, Dr. Mack. I really do appreciate it. But you can go there and actually view all of the videos if you want to go back and reference some things. And we continue to broadcast live to Facebook every single week. In addition to Facebook, we do it on YouTube, in addition to Facebook. And then, as we said before, on the Emmanuel 9 Memorial Foundation page. So once again, thank you so much. We really do appreciate it. I'm gonna check the comments one last time.
I want to give a shout out to one of my mentors, Dr. Thaddeus John Bell, in Charleston. I say he's on, and the wonderful things he's doing down in Charleston with Closing the Gap. He typically Labor Day weekend has a big jazz festival, concerts, and for about 3-4 days. And they do some big stuff down there, and he's raising a lot of money to try and help close the gap in healthcare down there. They actually named one of the health centers down in Charleston County after him, and that's well deserved. And so as a part of that FEDER system down in Charleston, as a network, almost kind of like Healthcare Partners is here, but it's what they have down in Charleston area, and one of those facilities is named in his honor. So I do want to recognize him, as I always do, and always give him a lot of credit for helping me when I was trying to decide, what I wanted to do. And in a lot of ways, what I've done is mimic what he's done as far as going into primary care and as far as being involved in sports medicine as well. He was a team doc down at Charleston Southern, which was Baptist at the time. So, and his son was my best friend in college. So I do want to, give him a shout out every chance I can get. So thank you, Dr. Bell. Appreciate you. And we'll talk soon.
All right. That's awesome. It's always good to have great mentors. Always good. Yeah, always good. Just want to make another announcement as well. There's going to be a virtual Unity Day on Monday at 6 p.m. on Facebook. It's hosted by the Peaceful Protest. For the virtual Unity Day, they will have speakers, which will include police chiefs, the mayors of Conway and Georgetown, and South Carolina Senator and House of Representatives member, and then some special performances. So mark your calendars for Monday at 6 p.m. here live on Facebook. This group has gathered the speakers together, and I guess they're going to just kind of have some discussions about some of the issues that have affected us over the past few months and years or whatever. But 6 p.m. virtual Unity Day online right here on Facebook, hosted by the Peaceful Protest. And, we'll certainly post that information to the group and, elsewhere. But Dr. Mack, I just want to make mention as well, since Brother McQueen is on this coming Monday, we will not broadcast the Whittemore Community Magazine, but we will come back the following Monday. And I think that is October the 5th. Let's double check that. I can't believe October is rolling in already.
Yes.
Yes, so Monday coming up is the 28th. The following Monday is October the 5th. October the 5th, the special guest on the Whittemore Community Magazine Live will be the Horry County Democratic Party. And Brother Edward is working on a few things for that particular show. So tune in to hear from the Horry County Democratic Party members. That will be Monday, October the 5th at 7 p.m. And if you have any show topics or anything that you would like for the magazine to cover or to dig into, you can certainly leave a message on the Whittemore Community Magazine's Facebook page or you can go to the Whittemore Community Magazine's website at wcmagazine.net, and someone will get back to you, I promise. So with that being said, Brother Mac, it has been great hanging out with you for the past hour and 20 minutes. I do appreciate it. You know, Friday's my favorite day of the week, so I'm going to try to relax it a little bit. I heard that we have some rain coming in, so that's a good time to, you know, sink my teeth into a project or put my head on a pillow and sleep or do something.
There you go. There you go.
And I want you to do I want you to do the same, because like I said, I popped in real quick to drop something off to you, and he was humming. He was, you know, going and preparing for this. And we can't thank you enough. So thank you, Dr. Mac.
Okay, thank you. Thank you. And take care. All right.
All right. Okay, everyone. Take care. Have a good night.
Good night.